Awesome.
So Rumi, thanks so much for coming on the Medicare Home Therapy show. This is my chance to hear about you, your practice, and share that information with the community. So first, I've got to understand this. Tell me a little bit about your education and your background, and where are you from exactly?
Yes, absolutely. It's a good question. I get that all the time, especially with that interesting name that I have. So I was born in Bulgaria. It's out in Eastern Europe. And I lived there for several years and I moved to the United States in 1999 with my family.
Wow.
Grew up in Minnesota. I don't know why they chose that way, but hey, that's kind of where. And so, yeah, I spent most of my childhood in Minnesota. It was great. And then from there on, I pursued my undergrad degree in athletic training. I spent 4 years in Winona State University. Great program, learned a ton, very hands-on with the athletes, with the community, working in different settings. And then I also got some good exposure working at Mayo Clinic down in Rochester. It's had a good, nice 1 month internship there, working with very high-end doctors, physicians, physical therapists, athletic trainers. So very, very evidence-based practice there. So lots of research and understanding why we're doing a certain, exercise or technique. So it just kind of really made me a more rounded therapist and kind of digging deeper into a patient's history and their assessments, evaluations. So it was a great learning experience.
Now,
And
how did you go from athletic training to occupational therapy? I love it. I've worked with some amazing OTs over the last 20 years that come from athletic backgrounds. But what was it for you that took you from ATC to OT?
yeah, I that was the number one question when I was applying for OT schools. So as an OT, I think what really draw my attention to it is looking at the person as a whole, as a more of a holistic kind of model. It's like, okay, yes, they're having this ailment, back pain, shoulder pain, neck pain, and what functional activities are they being impacted by? Like, can they not? Are they having difficulty reaching and completing certain meals around the home? Are they having difficult time dressing? So it just kind of think that's kind of where that background, even from athletic training or my internship at Mayo, is like, okay, like, is there something further that we can look at that's impacting their day-to-day function? So I think that's kind of where I drew my career, my love into more an OT based field. And then with my background in athletic training, I think that was a great combination. I can incorporate both the therapy side as an athletic trainer, and then looking at the more of an OT sense. So really looking at the patient as a whole there. So that's kind of why I really drew into the OT side of things, and did go back and forth between PT and OT, but once again, for those reasons, why I chose occupational therapy.
And so tell me, you have your own practice. Share the name
Mhm.
of your practice with everybody.
Yes, it is Petkov Bodywork Therapy.
Awesome. And so the body work part in there, like that's not something you typically see if you're looking for an occupational therapist. Tell
Yeah.
me about your practice, what it is that you do, because you run a very unique kind of service. Just kind of explain, if somebody's never been to you, what can they typically expect on the first session, and what kind of services are you
Yeah.
providing?
Yeah, so to kind of go back even before, so actually I started this during school. I had this background in athletic training. I was like, hey, I had this, while getting my OT degree, and I was like, I have this skill set. I need to use it. I didn't want to be out in the field for long hours throughout the weekend. So I bought a treatment table with some just general equipment, and so it was very kind of very manual based initially started. So I look and assess, I take a, just have a patient standing, look at how their body's moving, where they're compensating. And so it's very manual stretching, muscle energy kind of techniques, and then providing them with just general exercises. So that's kind of where a lot of the body work came from. Um, and then so, and then my practice actually developed into more of a outpatient mobile basis, because at that time, after I finished my OT degree, I was in a home health setting. And so from there on, I understood the importance of doing a lot of these therapy at home, doing home assessments, fall prevention, exercise at home. So I was like, hey, this is a great model to be, mobile based, deliver services in the patient's homes, especially the ones that can't get out of their homes, and have other, ailments that are preventing them to, go to a clinic. And then the reason kind of why I did the mobile outpatient basis is because I saw that after we discharged from home health, they were kind of left empty-handed. They didn't know exactly what to do. Follow through the HEP wasn't great, as most therapists know. So I was like, hey, there's got to be another setting. So I knew there's, of course, the outpatient clinic based, but still a lot of them couldn't, get out of their homes, couldn't go to a clinic. So I was like, hey, I can still have this mobile base, but make an outpatient. So that's kind of where, and actually it happened all during the COVID times. I, got myself credentialed through Medicare, did that on my own, and then just kind of grew and had my own billing team, kind of just grew all this through by myself. And so, yeah, right now, the main patient demographic is the geriatric population. I am seeing some on the younger side, some like 30-year-olds, 20-year-olds, but most of it is at home, delivering more of a kind of, mobile at home therapy basis. And then focusing really on just general, fall prevention. So a lot of them have this fear built up over time. And so my biggest thing is like, hey, let's just, build you up where we minimizing those fears, allows you to get back out in the community, step out into the backyard, clearing the thresholds, not being so scared or holding on to furniture. And then, and also working on this general strengthening, balance exercises, and also at the same time offering the home assessment too. If there's something that I'm recommending, a grab bar or some kind of shower chair, I can also provide that input there as well, while in their homes. And I've had a lot of good outcomes. I'm working with fresh stroke patients, currently straight out of the hospital. The family didn't want them to go through the SNF and inpatient home health. It called me right away. It's like, hey, so working with fresh stroke patients, Parkinson's, hip fractures, humeral fractures, to the easy ones, more like just general low back pain or history of falls. So those are kind of the type of, character or demographics of patients that I'm working with right now.
I think what's so important for the people watching this to know is that Medicare does cover what's called outpatient therapy in the home. So often we hear of home health therapy, which requires nursing in multiple disciplines.
Yeah.
But Medicare Part B, which you're a contracted provider, you're participating, is a service that pays for you to come to the individual's home, even if they're not homebound.
Yeah.
And so what's amazing to me is that as an OT, you focus on function. With the history of the athletic training background, you understand strength and physiology. And so you kind of marry the two in a way that helps a Medicare individual who maybe doesn't have transportation to an outpatient clinic or just want somebody who can tailor a treatment to their specific situation. So many times older parents, there are adult children in the family who are trying to find services for their older parents, and they can't take them to an outpatient therapy clinic that closes at 5 p.m. So you've got somebody like you who could come to the home. It's still covered by Medicare Part B. Most patients have some sort of secondary or supplemental that covers the balance. It's just a phenomenal service, and so few people actually know about it. Now, last question before I let you go. So what are the service areas you're providing service to, like the geography? What cities, zip codes? Where are you?
Yep. I cover, so I'm located in Phoenix. I do a very large area. I cover as far out west, out in Surprise, Sun City. Those are more the retirement communities. I do cover Phoenix, Glendale area, and up until Peoria, kind of north side of Arizona. And then heading more to the east side, I do a little bit of Gilbert, Tempe, Mesa area. I've kind of started to branch out into that area just because there's another aging community out in that part of Arizona. So it's large. It's a lot of driving, but I think there's a lot of need for those cities and communities. So that's kind of my basically entire Arizona.
Yeah.
Yeah.
Well, that's just amazing. I want to be mindful of your time and respectful. So what I'll do is I'll go ahead in the description below the video. I'll post your contact information for your website and other ways that people can reach out to you.
Mhm.
And for those individuals that are watching, Medicare Part B does allow the patient to see Rumy without a physician referral, but if you guys decide that you are going to go into a plan of care, there will be a physician involved, just kind of signing the plan of care and making
Mhm.
sure there's no medical reason that the patient's not allowed to participate. But all in all, just the thought that I could have you go out to my mom's house after she had a hip replacement surgery
Mhm.
without having to worry about getting her to a clinic and doing all that stuff. It's just the peace of mind and the security of knowing that there's a licensed therapist there ready to go is incredible. So Rumy, thank you so much for taking the time to come on and talk to us and just hang out for just a minute while I wrap up this segment.
Thank you.
So guys, if you're looking for therapists that are contracted with Medicare Part B and do accept the Medicare allowed amount and the Medicare fee schedule, but are willing to come out to your personal home or residence to provide physical therapy, occupational therapy, or speech language pathology services, absolutely check out the website, medicarehometherapy.com, and they will find the therapist in your location who can get you what you need. Thanks so much for watching.